Medics should be required to study nutrition and lifestyle medicine. Greetings, my name is Nanette Pierre. Today, I want to talk about something that seems so obvious yet is shockingly overlooked in our healthcare system, the role of nutrition and lifestyle medicine and medical education. The leading cause of death today, heart disease, diabetes, stroke, and obesity, are largely preventable. They all have a common thread, lifestyle. But here's the problem. The very people we trust with our health, our doctors, are often underprepared to address these root causes. In fact, the average medical student receives fewer than 20 hours of nutrition education during their entire medical school training. That's not even a full day worth of lecture. This disconnect between what causes disease and what doctors are trained to treat is not just an oversight, it's a public health crisis. Medical education is still centered on acute care and pharmaceutical intervention, but lacks the tool to help people prevent or reverse disease before it requires a prescription or surgery. This is why nutrition and lifestyle medicine must be required component of all medical school curriculum. First, let's talk about prevention. Nutrition and lifestyle education is key to preventive care. According to Frame, conditions like heart disease, high blood pressure, and type 2 diabetes are often fueled by poor diet, physical inactivity, and chronic stress. These are not rare disease. They affect millions of people, and we've grown too comfortable seeing them as inevitable. But they are not. They are preventable and in many cases reversible too through practical lifestyle intervention. When medical students are trained to counsel patients on things like whole food diet, regular exercise, sleep routine, and stress reduction practices, they become equipped to help patients make meaningful changes that keep them out of hospitals in the first place. This isn't just about reducing health risks, it's about empowering patients to live healthier, longer lives. Now, the obvious question is why aren't doctors already doing this? The answer lies in how we train them. Medical school focus heavily on pathology, pharmacology, and surgical procedures. As Villacorta explained, most programs treat nutrition and lifestyle as elective, not essentials. Even though chronic disease make up the majority of a physician's workload, students graduate without the knowledge to help patients make sustainable behavior changes. This is where the system is failing both our doctors and their patient. When physicians are not prepared to have these conversations, they default to what they do know, prescribing medication. But this approach treats symptoms, not root cause. If medical education include mandatory coursework in nutrition, behavioral change, and motivational interviewing, we could start transforming how healthcare is delivered, moving from reactive to proactive. Let's consider what happens when doctors do receive this training. Doctors trained in nutrition and lifestyle are more confident, more credible, and more effective with their patient. They don't just suggest vague advice, eat better or exercise more. They give practical science-based recommendation and can tailor plans to each patient needs. Has framed notes, patients are more likely to follow through on lifestyle changes when they feel supported and when their doctor clearly understand how these habits connect to their health, and the results speak for themselves. Reduce blood pressure, low cholesterol, improve blood sugar control, better mental health, and even reduced reliance on medication. Think about the ripple effect. Fewer emergency room visits, less financial strain on the healthcare system, and stronger, healthier communities. Of course, some people argue that doctors don't have the time to include lifestyle counseling in already brief appointments, but that argument misses the point. We are not suggesting doctors become dietitian or personal trainers, but rather that they are informed enough to screen for risk factors, providing initial guidance and refer patients to specialists when needed. This is about integration, not overextension. Also, a short conversation about lifestyle can prevent years of costly treatment down the line. Another misconception is that patients won't change their habits, but studies show that people are far more likely to adopt healthy behaviors when they are coached by a trusted medical professional. We just need to give future doctors the tool to make that coaching effective. So, what does all this add up to? Requiring medical students to study nutrition and lifestyle medicine isn't just a good idea, it's necessary. The benefits include early detection and prevention of chronic illness, improved patient trust and engagement, reduced healthcare costs for patients and system, a shift towards health equity and long-term wellness. This isn't just about updating the curriculum, it's about redefining what it means to be a doctor in the 21st century. As we face rising rates of obesity, mental health struggle, and preventable disease, we need physicians who see the full picture, who treats the person and not just the illness. In closing, I urge you to see this as more than a curriculum issue. It's a justice issue, a cost issue, and a life-saving opportunity. We have the science, we know the impact. What's missing is the training. I encourage you to support the petition for required nutrition and lifestyle course in all medical schools. Speak to your classmate, your professor, your advisor. Advocate for the change you want to see in healthcare. Because when doctors understand the power of food, movement, sleep, and stress management, they don't just treat disease, they help people thrive. Thank you.